My name is Matthew Crosby, and this is my policy speech. Whether we've seen it on TV or seen it within our own families, we have witnessed someone suffer through a terminal illness. Terminal illnesses such as cancer or multiple sclerosis can take the quality of life out of anybody, leaving them with nothing to remember but pain and suffering. The Mississippi Death with Dignity Act will give anyone suffering from a terminal illness the right to pass at their own convenience. According to the NHDD, 42% of Americans have a friend or family who suffer from a terminal illness. Not only do terminal illnesses affect the patient, but it also leaves a heavy burden on the family as well. You must have a terminal illness to really understand the pain and suffering that they go through every single day. Imagine a time where you felt the worst pain in your life, except that this pain was a pain that never ended. Is this really the quality of life that you'd want to live? Where is the quality in pain? I hope to inform you after this speech on how important it is to give someone with a terminal illness the decision to determine how they can remember their own lives. The life of a terminally ill patient should have the right to decide their destiny, their treatment, and their family's burden. Now let me provide you with some information on the Senate Bill 2283, the Mississippi Dignity with Death Act. Senate Bill 2283 gives the right to Mississippi residents suffering with a terminal illness to voluntarily self-administrate lethal medications. This could benefit so many of our suffering cancer patients across our entire state. Not only do patients suffer from their illness, but the treatments alone can prove to be harmful and lead some haunting side effects. Under very strict circumstances, terminally ill patients should have to be evaluated by a number of physicians and psychiatrists to evaluate their mental health and state of their terminal illness. After all likely causes of pain are ruled out and are diagnosed as uncurable, doctors should be able to proceed with their patients' wishes. Once determined that their wish to die is not caused by any uncurable mental illnesses, the physician can then prescribe a medication that can slowly ease their way into a painless life. Much like how any doctor can prescribe an antibiotic for an infection, or how they can prescribe a diuretic for high blood pressure, or potassium just for the extra vitamin. According to the Mississippi Department of Health, more than 14,800 people are diagnosed with cancer every single year. While some cancers can be treated, sometimes cases are so severe that death and pain are inevitable. Common side effects of the end stages of a terminal illness include confusion, difficulty sleeping, incontinence, decreased appetite, weight loss, severe depression, and the one that we all most suffer from is pain. Can you imagine yourself in the state of mind where you can't even remember the ones that you love the most? Can you imagine yourself constantly laying in a bed where nurses and doctors treat you with even more pain? Imagine breaking all of your bones at one time. This is the pain level most experience with their terminal illnesses. How can you put that burden of this quality of life on your family? Now let's detail the rationale of terminal illnesses and the harsh reality. Instead of saying they're dying anyway, I'll say this: they're going to die anyway. The term dying to me is more of a symptom than terminally ill patients suffer through. Dying is difficulty sleeping, losing appetite, confusion, depression, incontinence. Can you see how these symptoms relate to dying and terminal illnesses and how they are common? Terminally ill patients can avoid the symptom. Very much how we take NyQuil for a cold to help our symptoms and avoid a runny nose at night. Supporting the Senate Bill 2283 would give these terminally ill patients the relief that they need. The pain and suffering doesn't just affect the patient, but it also affects their loved ones as well. Living with the image that someone you love very much suffered through so much pain and discomfort in the end stages of their life can be devastating. We've all heard the saying, if you love me, let me go. Let them go. Let them go from the pain. Let them go from the suffering. No one should have to deal with the consequences of watching someone suffer from dying. In conclusion, I have given you enough information on why is it important to support the Senate Bill 2283 and how it should take effect. Now let me summarize what I've stated earlier. I myself have witnessed a number of people suffering from a terminal illness without the decision to ease their transition to death. When I learned about the Senate Bill 2283, I thought to myself, why isn't this already a thing? Why hasn't this already taken effect? Why aren't people supporting this? Terminally ill patients are suffering every single second of every single day. Give them their right. Give those patients the right to choose how they treat their symptoms and choose how their family can remember them in their last moments of their life with them. Give someone the right to end their life and end the pain and suffering of their terminal illness so that they can avoid the continuous suffering of dying. Let these terminally ill patients decide how their families can remember them in their last stages of their life. Give these patients the most humane treatment. Give them the right to ease the family burden. The Senate Bill 2283 isn't a policy that just ends your life at your own terms, but it allows an escape from freedom of pain. This is a cure for uncurable terminally illnesses. Daily we treat all kinds of symptoms. If we have a stopped up nose, we take a decongestant. If we have a fever, we take an anti-inflammatory. If we have the flu, we take Tamiflu. Why? To ease the symptoms. Why shouldn't terminally ill patients allowed to do the same thing? Choose yes to the Senate Bill 2283. Choose yes to end the consequences of terminally illnesses such as cancer and AIDS. Choose yes to bring a better quality of life to terminally ill patients and clients. Choose yes to give someone the right to choose how their life should end. A life free from pain is the life you're living now that many do not have the luxury of having. Bring mercy to these patients and their families. Bring an end to the pain and suffering once and for